Varicella zoster virus is a very common virus, also known as chickenpox. The virus typically lasts 4 to 7 days. The symptoms include rash, blisters filled with fluid, itchiness, fever, tiredness, loss of appetite, and headache. The symptom that varicella is best known for is its rash and blistering. The rash will typically start on the chest, back, and face, and then spread to the rest of the body. The other areas of the body that this can spread to, that is most painful, is the inside of the mouth, genital areas, and on your eyelids. Vaccinated people who get varicella zoster virus sometimes experience a more milder case with little to no rash or blisters and only experience slight red spots, mild or no fever, and sometimes are sick for a shorter amount of time. But in other vaccinated cases, people are experiencing the same amount of sickness, so it's really just random. According to the CDC, it is an acute infectious disease, which means it is transmitted very easily and the symptom period is pretty brief. It is a DNA virus in the herpes virus group, and the incubation period lasts 14 to 16 days after exposure to varicella. Rash is typically the first sign noticed in chickenpox. In unvaccinated people, the rash spreads rapidly, but in vaccinated people, chickenpox is much more mild. The transmission of chickenpox is very highly contagious, and it is spread by direct contact, inhalation of aerosols from the skin lesions, and also from the aerosols produced in the respiratory tract. People with chickenpox are considered contagious until all of their lesions have crusted over. Some complications that can occur because of the varicella zoster virus are bacterial infections of the skin, pneumonia, cerebral ataxia, and encephalitis. According to Medscape.com, the primary infection of varicella zoster virus can be found in the sensory ganglia. The people who are at high risk for varicella zoster virus are immunocompromised people, newborns whose mothers had chickenpox within 5 days of birth, and premature babies. Treatment is usually based on who is affected by varicella zoster virus. Treatment option for varicella zoster virus is oral acyclovir. Another treatment option is varizoster immunoglobulin, which is used mainly on high-risk patients. A preventative measure for varicella zoster virus is the varicella zoster or chickenpox vaccine, which is administered first at 1 year old, and the second dose is administered anywhere from 4 years old to 6 years old. The varicella zoster vaccine was introduced in the United States in 1995. Before 1995 and before the introduction of the varicella zoster vaccine, 100 to 150 people died each year due to varicella zoster virus. 4 million people each year in the United States got varicella zoster virus, and 10,500 to 13,500 people were hospitalized every year due to varicella zoster virus. With the introduction of this vaccine, they have drastically decreased these numbers. According to History.com, varicella zoster virus dates back all the way to ancient times. However, they are unsure of how it got its name. The CDC estimates that an infected person with varicella zoster virus can spread the virus to up to 90% of people whom they come in contact with that are unvaccinated or never had chickenpox in the past. In healthcare settings, the main source of transmission is due to delayed diagnosis of varicella zoster virus. They also use preventative measures to prevent the spread throughout hospitals by using negative airflow rooms until the varicella zoster virus lesions are fully crusted over. If they do not have access to that, the patient will be isolated in a room and have no contact with anyone unless there is visible immunity from the other person that would be interacting with them.